Well, surprising new report says flight attendants face a higher risk of cancer, even though they are healthier than the general population. Also making medical headlines, a clinical trial set to begin in the fall is going to look at low-carb diets and if they can help patients who are battling certain types of cancer. Here to break down some of these stories for us is Dr. Adam Kassam and Dr. Naila Kassam joining us in studio this morning. Good to have you both back with us.
Likewise.
Thank you.
All right, Naila, let's start with you. This is a Harvard flight attendant study. It began 11 years ago. Here's what they found. Flight attendants did have higher rates of breast, melanoma, uterine, gastrointestinal, thyroid, and cervical cancers compared to the rest of the general public. But they are also less likely to smoke or be overweight. So what's the cause of the cancer?
Yeah, so there are 3 proposed theories for why flight attendants have a greater rate of these cancers. So the first is actually due to radiation exposure. We know the higher the altitude you fly at, the more radiation you're exposed to.
I did not know that.
And we also know that radiation is an independent risk factor for cancer. Now, the second theory actually has to do with shift work and the sleep disruption cycle. So when we've looked at other studies of people doing shift work, we also see that over a period of time, if they've been doing night work for about 20 years, they also have an increased risk of certain cancer.
That's very interesting. The first question I had when I saw those results, however, was, did they also check the pilots? They're on the same plane, flying the same altitudes.
Not in this study, but there was a study that was published in the Journal for the American Medical Association in 2015 that showed that for a pilot who flies at 30,000 feet for an hour, that was the equivalent of 20 minutes in a tanning bed. So,
really?
Yeah, so there is potentially a similar risk, a similar exposure that they are having, similar to the flight attendants. The CDC, however, for casual flyers, for the general public, did issue a statement saying that there was no increase in their risk for these types of cancers. We know that these studies are correlation studies and not causation studies, so we need more data to look at cause and effect.
What does that mean for non-medical people?
It means that there might be an association between a specific exposure and an outcome, but it's hard to say that one causes the other. Okay. And so what we would say to patients is that if they're worried about a certain environmental exposure or an occupational exposure that they're associated with, they should go see their family doctor or an occupational health team for further assessment.
All right, the other study that we mentioned was this clinical trial that's going to look at sort of low-carb diets for cancer patients. Why the concern there?
So what they're doing right now is they're looking at the ketogenic diet, which is popularized right now for weight loss.
Which is lots of protein, less carbs.
Exactly. But they're actually, the medical community has been using this diet for a number of years, mostly with children who are facing epilepsy, who are not responding to typical medication.
Interesting.
Now, with this study particularly, what they're doing is they're looking at the ketogenic diet and if a particular cancer drug will do better in people who are on a lower carb diet because they'll have less levels of insulin in their body, and this just might make this particular drug more effective.
And this has to do with sugar levels in your body because carbs broken down eventually becomes sugar in your body.
Exactly.
Yeah.
Huh. So what are your thoughts behind low-carb diets then?
Right, so we know the ketogenic diet is very popular nowadays. It's very good and has been shown to be very effective for weight loss. The trouble with the diet is that it's very strict, and so doing this long-term can be a challenge. And we know that if you lose a lot of weight on a diet, for example, and then gain it all back very quickly and do that over and over again, that's actually pretty harmful for your body. We also know that this ketogenic diet can have a risk in patients who have chronic kidney and liver disease. And so anyone who's starting the diet should go to their family doctor or to a practitioner, like a dietitian, to get assessed before they start.
Fascinating information. It's always good to find out, dig a little deeper into the headlines behind some of these studies and behind some of these trials. Good information, and nice to have you both here this morning.
Thank you.
Thanks so much.